For planning, community engagement, advocacy, and design, we're finally piloting an innovative new program that quickly connects people experiencing a mental health crisis with trained mental health professionals with the city of Long Beach. Every day, we receive calls from concerned residents about family members or students, members of our community, or individuals we may not know who are experiencing mental health crises. And now many of those calls can be directed from a police response to the city's new community crisis response. We're calling it CCR. We're working on the name, the CCR team. This is a 5-person team of professionals who respond to a subset of calls for service when there's a need for mental health support, health education, and resource navigation. The team will support the safety and health outcomes for community members at our center of calls. With a firm commitment to supporting our residents in times of distress, this new team will create opportunities to make connections within the communities that we serve. The goal is to build on those relationships and ultimately earn the trust of those who require assistance. This is important. As advocates of public health, as a public health city, we understand that mental well-being is an important aspect of one's overall health and resilience in their community. It's a part of the core work that we must do as a public health jurisdiction. This program represents a pivotal milestone in creating a healthier Long Beach, one that proactively addresses mental health crises with compassion and evidence-based care. Qualifying calls may have originally have had a law enforcement response are now being directed and rerouted to the CCR team, which is made up of both mental health professionals and health department staff who have been trained specifically to assess and assist with mental health crises. We recognize the immense importance and potential of the CCR team to connect residents to the help that they need, focusing on behavioral health and quality of life issues while also improving public health and health outcomes in Long Beach. And we see this as a team approach. The Community Crisis Response Team has been made possible through strong collaboration with the city's Department of Health and Human Services and our police department and our fire department and our Department of Disaster Preparedness, where is the home for all of our dispatch efforts in the city. I want to thank all of our public safety leaders for embracing this alternative response model. Together, we're taking a path to better serve people in mental health crisis while reducing the burden of the city's other emergency response services. We're all one team, and we're adding additional capacity to be more responsive to the quality of life issues that our residents care about. Ultimately, this program seeks to create safer, more compassionate, and healthier communities where mental health is being prioritized and crisis response is met with an appropriate response of care and understanding. Today, we're taking a bold step toward change. This new journey will redefine how the city addresses crisis response. And now I want to introduce Council Member Roberto Uranga, who will talk a bit more about how the CCR team will further some of our priorities on racial equity and reconciliation.
Thank you, Mayor. 2 years ago, the city declared public health crisis through the reconciliation initiative that we adopted back then. As a result of that, we had the creation of the Community Crisis Response Team. It's a long time coming, but one that is certainly welcome for the city. Mayor Rex Richardson, I represent the West Long Beach area. In that area, we have a need. And what this team will do is respond to that need. We also have needs in other parts of the community, which will be addressed later. But emergency response is what we do. We have the health department. That's what it's for. This is a great collaboration with the fire department, police department, our emergency response center, and all the city council offices in the city to address what's taking place in their communities. And that is that racism is a crisis. And what this team will do is respond not so much as to the direct racism, but also to the indirect, those that are affected by violence and other issues that address our community. So I welcome this. I look forward to working with the community response team as we further the advances of service to our community, because that's what we're all about, service. So thank you, Mayor. And now I want to bring up Councilmember Sulisaro to say a few words as well.
Thank you, Councilmember Uranga. So I'm honored to be part of of this momentous day, which represents a significant advancement in how the city will address mental health crisis in our communities. As part of the Public Safety Committee that advocated for the program, I am so happy it's finally come to fruition. This program further demonstrates our collective commitment to improving our residents' well-being and showcase a progressive approach to mental health care by fostering positive perception and trust between the community and the city's public services. The Community Crisis Response Team will provide care that addresses the broader mental health needs of our residents, going beyond a singular crisis response to a proactive approach of ongoing support and healing of the person being responded to. We know that mental health crisis can leave people feeling isolated and hopeless. The CCR team will extend compassion and understanding, instilling a sense of support and optimism. And I'm going to hand it over back to our mayor. Thank you.
Thank you, Councilmember Uranga and Councilmember Sorrow, for your advocacy to bring the CCR to fruition. And this is housed in our health department. And a lot of work has taken place on behalf of our health department to make this happen. So our next speaker is Kelly Colopy, who will further discuss the operations of the CCR.
Good morning and welcome to the Health Department. It's nice to have you all here today. First of all, I'd like to call out our new CCR team. You can see them here behind us in the blue shirts. And what I want to be able to say is just they have stepped into roles that have not existed in the city of Long Beach before. And they have taken on those roles with passion, excitement, innovation, curiosity, I don't know, a lot of different words, all that are so positive. And I am so, so proud of this team and this effort as part of the health department. So the alternative crisis response programs like our CCR are evidence-based practices that are cost-efficient, reduce arrest and jail recidivism in people experiencing mental illness, and they also improve access to mental health services. This is exciting new territory for us, and we're so excited to take it on. As Mayor Richardson outlined earlier, the CCR team is made up of both mental health professionals and health department staff who have been trained and are well equipped with a deep understanding of mental health issues, de-escalation techniques, and trauma-informed care, which better equips them to handle crisis situations with empathy and skill. The 5-person team includes a crisis intervention specialist, a public health nurse, and a peer navigator. The CCR team is also supported by a program manager and a team supervisor who can provide supplemental support and consultation to the team as needs arise. The CCR team can also provide support in the field, including crisis intervention support, de-escalation for individuals, suicide assessment and intervention, providing basic needs items, transportation, resource navigation, and also support, referral supports to different services in the city and more broadly into the county. So how does this work? Anyone experiencing a mental health crisis or who sees someone who may be experiencing a mental health crisis is encouraged to call the non-emergency line at 562-435-6711. If you believe that you are experiencing or witnessing a potential life-threatening situation, then you call 911. It continues to be the primary response in life-threatening situations. In either situation, dispatch will assess the call's needs and determine the appropriate unit to respond, whether it's police, fire, or the CCR team. If the call meets the eligibility criteria for CCR, then it will be dispatched. If the call does not meet the CCR's criteria, or if the CCR team is unavailable, or if the call presents an immediate life-threatening emergency, then dispatch will either send the appropriate unit, either police or fire. As mentioned earlier, the CCR team partners with the police and fire department and dispatch for daily operations. CCR is not a co-response model. We do not show up together. So we won't be arriving with police units or fire department, but we will be communicating through dispatch if the needs of the call exceed CCR's scope of service. The CCR team can also be requested as an additional resource by responding police or fire units if or when the respective departments determine that a situation would benefit from mental health support or resource connections instead of law enforcement or medical response. The responding units would request CCR to respond through dispatch if that is needed. CCR also partners with police, fire, and dispatch departments through weekly and monthly data reviews, and they are actively and ongoing in conversation to improve the responsiveness and the performance of the CCR unit. So we're very excited to launch this and to be able to announce it today in Long Beach. And by bringing together our public health and public safety response and working together through tough moments, we're ensuring the community receives the resources, education, and empathetic response. These civilian responders will play a key role in making the city a healthier and more connected place for everyone. And with that, I'll turn it back to the mayor. Thank you.
All right. Thank you so much, Kelly. So as you can see, the city is adapting to the challenges that face local government. No two crises are the same. We have to expand our ability to respond when an emergency happens. And I believe that that means that government should continue to innovate and find new ways to make a difference in the lives of people. And I think that's what local government should do. Government should help people. And as we see and understand the crisis that's sort of developed with respect to mental health in our communities, it's only appropriate that our local government, our city step up and respond in a way that is empathetic and responsive and innovative. And so thank you so much. Well, now we know that it's hot out here, so we excuse the CCR team to go get a little bit of shade, and we'll open it up in case there are any questions. And if the council members want to get out of the sun, now would be a good time. It's totally fine. I think, Kelly, you with me. You stand up here with me. She has the answers. So at this point, if there are any questions, we're happy to take them. Okay, right here. You just jump right in. Come on in. This is our first crisis response team. So if we see that the program's working and we know that there's a demand, then we'll continue to evaluate if there's a need to expand the program. But this team's been piloted for a few weeks, and we know that there's certainly a need, and we want to continue to test and learn and look at data and evaluate to make the decisions about what's next. Kelly?
So this is an 18-month pilot with one team. And so we'll be looking to see and continually working to determine what else is needed, looking at different partnerships with the county as well and 988. And so there's a lot of opportunity in these next, 17 months for the pilot. And then based on what those results are and continued opportunity, we would look to expand. So you probably won't know if you qualify. So you call dispatch and you explain the situation. At that point, dispatch determines whether it's appropriate for the CCR call and whether they're available. And if it does qualify and they're available, they would go. If it does not qualify or they're not available, you would have a police or fire response. You cannot specifically request the CCR at this time. So it's a crisis intervention specialist, there's a mental health specialist, a public health nurse, and a peer navigator. Those are the three that go out into the field.
That's four.
It's three. What will the hours? The mental health clinician is the crisis intervention. So the hours are 10 to 5, Monday through Friday, focused right now on the west side of Long Beach as part of the pilot. We'll be looking at those data as well and determining what additional opportunities will be, and then also to determine if there are other hours or time frames in which it would be more appropriate to respond.
We're going to go over here.
Yes.
Yeah. Yes. Mm-hmm.
Yeah, so the REACH team is very much focused on people experiencing homelessness and access to homeless services, right? As well as, so that also has a public health nurse and a mental health clinician as well. In this case, it's focused more specifically on people who are not experiencing homelessness, so that we can build capacity for others within our community who are experiencing mental health crises. They are coordinating and they are talking and they're doing everything they can to leverage each other's skill sets as well. Correct.
There's a relationship. Explain that relationship.
Correct. Yeah. So if the police were to call, then they would work together for a minute and then determine whether it's what to do next, and then it could be passed off to the community crisis response team, who would then take it from there to attach to services and further commitment. So the Long Beach Recovery Act was the kickoff funding, and then the general fund committed to make it an 18-month pilot. We have not received additional dollars at this time, but we'll be working closely with the Department of Mental Health at the county level and other resources to look at additional opportunity. So mental health crises are definitely on the increase. I can't rattle off statistics for you at the moment, but we can get you some. But we are seeing an increase in mental health overall and mental health crises. And so we wanted to make sure that we're providing the appropriate response to those spaces. And I think when we're sending out a mental health clinician, a public health nurse, a peer navigator, right? There's a lot of work in the de-escalation, the building relationship, and then ongoing services and connection. We do have there are MET teams within the police department that include a mental health clinician as well, more in a police response. But everybody is being trained together and understanding the different roles for the different teams. I'm turning to the team. 3 to 4 in a day. Yeah. It is. So they're very much connected. So if it escalates to a point where safety might be a concern, then that is our partnership with the police and fire department as well to determine if they would need additional supports. But they're very well trained in de-escalation techniques, relationship building, and others. And we are working to send them to those where where that nonviolent is one of those things, right? One of those criteria for which they would be dispatched or not.
All right. Any additional questions? Right. Right. Yeah, it all goes to the same call center. It allows us to triage the calls if you use the non-emergency number, but the dispatcher will make an assessment if you do call 911 and that, hey, the team is available and this is appropriate for that team, then they'll dispatch that team. So generally, look at it this way. We have a police department that responds to emergencies. We have a fire department. We have paramedics that respond to emergencies. We have mental evaluation teams that help support our police department. But this is the first standalone mental health response team in the city. We have homeless response. We have REACH teams. So depending on the emergency and sort of the evolving nature of the role of local government, that's why this is innovative, because it's our very first mental health crisis response team. And we want to learn from this over the next 18 months. We'll continue to talk with the county and talk with Department of Mental Health and the state about additional opportunities to build a more robust infrastructure around mental health in our communities. We know there's a great need, and this is but one pilot and one step toward localizing mental health services and supporting our community, and that's why this is important. I want to thank everyone for coming out and joining us today. And now we're going to turn it over to Spanish and Khmer interpretation. Thank you.
Hoy es un día importante para nuestra ciudad. Estamos iniciando un programa piloto nuevo e innovador que conecta rápidamente a las personas en crisis de salud mental con profesionales de la salud mental capacitados. Todos los días recibimos llamadas de habitantes preocupados por personas que están pasando por una crisis de salud mental. Ahora, muchas de esas llamadas se pueden virar de una respuesta policial al nuevo equipo de respuesta a crisis comunitarias, o CCR por sus siglas en inglés, de la ciudad. Con un firme compromiso de apoyar a nuestros residentes en momentos de angustia, este nuevo equipo creará oportunidades para establecer conexiones dentro de las comunidades a las que servimos. Desarrollar también esas relaciones y al final del día ganarse la confianza de las personas que requieren de esa asistencia. Este programa representa un hito fundamental en la creación de una Long Beach más saludable, una que aborde de manera proactiva las crisis de salud mental con compasión y atención basada en evidencia. Las llamadas calificadas que antes pudieron haber tenido una respuesta de las fuerzas del orden público se están desviando al equipo de CCR, que está compuesto por profesionales de la salud mental y personal del Departamento de Salud que han sido capacitados específicamente para evaluar y ayudar con la crisis de salud mental. El equipo de 5 personas incluye un especialista en intervención de crisis, una enfermera de salud pública y un navegador de compañeros. El equipo de CCR también cuenta con el apoyo de un gerente de programa y un supervisor de equipo que pueden brindar apoyo adicional y consultas al equipo cuando surja la necesidad. Cualquier persona que pasa por una crisis de salud mental o que vea a alguien que pueda estar pasando por una crisis de salud mental debe llamar a la línea que no es de emergencia al 562-435-6711. Si cree que está pasando por o presenciando una posible emergencia que pone en peligro su vida, llamar al 911 sigue siendo el recurso adecuado. En cualquier situación, el departamento o el centro de despacho evaluará las necesidades de llamada y determinará la unidad apropiada para responder, ya sea la policía, bomberos o el equipo de CCR. Si la llamada cumple con los criterios de elegibilidad para una respuesta de CCR, se enviará al equipo de CCR. Si la llamada no cumple con los criterios de CCR, si el equipo de CCR no está disponible o si la llamada presenta una emergencia inmediata que pone en peligro la vida, el centro de despachos enviará otra unidad apropiada de la policía o bomberos. Estamos emocionados de ver el lanzamiento del equipo de respuesta a crisis comunitarias en Long Beach. Al reunir la respuesta de salud pública y seguridad pública y trabajar juntos en momentos difíciles, nos aseguramos de que la comunidad reciba los recursos adecuados, la educación adecuada y una respuesta empática. Gracias. Pasamos a la interpretación al Khmer. ¿Cómo? Margarita de la Torre. Gracias.
Pasam chimrip su bop on tang ak ni thangai niគឺជាថ្ងៃដ៏មានសារៈសំខាន់មួយសម្រាប់ទីក្រុងឡុងបិចរបស់យើងនោះគឺជាការដាក់ឲ្យដំណើរការសាកល្បងកម្មវិធីប្រកបដោយការច្នៃប្រឌិតថ្មីមួយដែលផ្សារភ្ជាប់ពលរដ្ឋកំពុងតែមានវិបត្តិទៅនឹងអ្នកដែលមានជំនាញផ្នែកសុខភាពផ្លូវចិត្តដែលបានឆ្លងកាត់ការបណ្ដុះបណ្ដាលត្រឹមត្រូវ ជារៀងរាល់ថ្ងៃយើងតែងតែទទួលបានសំណូមពរតាមទូរស័ព្ទពីបងប្អូនប្រជាពលរដ្ឋដែលលោកមានការខ្វល់ខ្វាយអំពីបងប្អូនយើងឯទៀតដែលកំពុងតែរស់នៅក្នុងស្ថានភាពមានវិបត្តិផ្លូវចិត្តឥឡូវនេះសំណូមពរជាច្រើននោះនឹងអាចផ្ទេរពីអំរែកដែលជាបន្ទុកឆ្លើយតបរបស់ក្រមប៉ូលីសទៅកាន់ក្រមថ្មីរបស់សាលាក្រុងសម្រាប់ឆ្លើយតបទៅនឹងវិបត្តិឬហៅកាត់ថាក្រម CCR ក្រុមថ្មីនេះត្រូវបានបង្កើតឡើងដោយមន្ត្រីដែលមានការបដិញ្ញាចិត្តមុតមមនៅក្នុងការជួយដោះស្រាយបញ្ហាជូនបងប្អូនប្រជាពលរដ្ឋរបស់យើងនៅក្នុងគ្រាដ៏លំបាកលំបិននេះក្រុមថ្មីនេះនឹងបង្កើតឱកាសនៅក្នុងការរៀបចំឲ្យមានការផ្សារភ្ជាប់ទំនាក់ទំនងទៅនឹងសហគមន៍ដែលយើងបម្រើយើងខ្ញុំជឿជាក់ថាការកសាងទំនាក់ទំនងល្អនេះគឺជាហេតុផលនិងកសាងជំនឿទុកចិត្តរបស់ប្រជាពលរដ្ឋឲ្យស្វែងរកជំនួយពីរដ្ឋនៅពេលដែលពួកគាត់ត្រូវការបាទកម្មវិធីថ្មីនេះគឺជាសក្ខីកម្មដែលសបញ្ជាក់ឲ្យឃើញអំពីគម្រោងសំខាន់របស់សាលាក្រុងនៅក្នុងការកសាងសហគមន៍ក្រុងឡុងបិចរបស់យើងឲ្យคล้ายទៅជាសហគមន៍ដែលមានសុខភាពល្អប្រសើរជាងនេះពលគឺកម្មវិធីនេះនឹងរត់ទៅរកប្រជាពលរដ្ឋមុនហើយដោះស្រាយវិបត្តិជំងឺផ្លូវចិត្តរបស់ពួកគាត់ប្រកបដោយក្តីមេត្តាករុណានិងការយកចិត្តទុកដាក់ថែទាំសុខភាពប្រជាពលរដ្ឋដោយផ្អែកទៅលើភស្តុតាងទៅនឹងស្ថានភាពជាក់ស្ដែងដូច្នេះចាប់ពីពេលនេះតទៅរាល់សំណូមពរតាមទូរស័ព្ទរបស់បងប្អូនប្រជាពលរដ្ឋយើងដែលពីមុនធ្លាប់តែពឹងខាងមន្ត្រីប៉ូលីសឲ្យជួយដោះស្រាយឥឡូវនេះរាល់កង្វល់បែបនេះនឹងត្រូវផ្ទេរទៅក្រុមឆ្លើយតបវិបត្តិរបស់សាលាក្រុងយើងវិញម្ដងបាទដែលក្រុមនេះមានសមាជិកទាំងអ្នកជំនាញឯកទេសផ្នែកសុខភាពផ្លូវចិត្តនិងមន្ត្រីនាយកដ្ឋានសុខាភិបាលដែលបានឆ្លងកាត់ការបណ្ដុះបណ្ដាលពិសេសដើម្បីវាយតម្លៃនិងជួយឲ្យបងប្អូនដែលមានជួបបញ្ហាវិបត្តិនោះបានទទួលការដោះស្រាយក្រុមដោះស្រាយវិបត្តិផ្លូវចិត្តឬក៏ CCR នេះមួយក្រុមមានគ្នា5នាក់ក្នុងនោះមានម្នាក់ជាអ្នកឯកទេសផ្នែកអន្តរាគមន៍គ្រាមានវិបត្តិម្នាក់ជាគិលីនុបដ្ឋាសុខភាពសាធារណៈនិងម្នាក់មានជំនាញផ្នែកមិត្តជួយមិត្តបាទក្រុមនេះក៏ទទួលបានការជ្រោមជ្រែងពីអ្នកគ្រប់គ្រងកម្មវិធីនិងអ្នកមើលការខុសត្រូវដែលអាចបន្តជួយផ្ដល់ជំនួយបន្ថែមនិងការពិគ្រោះយោបល់ទៅដល់ក្រុមនៅពេលដែលមានការចាំបាច់បាទដូច្នេះបងប្អូនយើងណាដែលមានវិបត្តិផ្លូវចិត្តឬក៏បងប្អូនឃើញនរណាម្នាក់ដែលអាចកំពុងតែមានវិបត្តិផ្លូវចិត្តសូមបងប្អូនកុំស្ទាក់ស្ទើរក្នុងចិត្តសូមតាក់ទងរកជំនួយតាមលេខទូរស័ព្ទនេះគឺ562 435 6711លេខនេះគឺសម្រាប់ករណីមិនបន្ទាន់ខ្លាំងក៏ប៉ុន្តែបើបងប្អូនជឿថាបងប្អូនកំពុងតែមានបញ្ហាធ្ងន់ដែលអាចគ្រោះថ្នាក់ដល់ជីវិតបើគ្មានការសង្គ្រោះបន្ទាន់ភ្លាមឬក៏បងប្អូនឃើញមាននរណាម្នាក់ស្ថិតនៅក្នុងស្ថានភាពបែបនេះសូមបងប្អូនទូរស័ព្ទទៅកាន់លេខសង្គ្រោះបន្ទាន់គឺលេខ911ដើម្បីទទួលបានធនធានសង្គ្រោះតាមការគួរដូច្នេះមិនថានៅក្នុងស្ថានភាពមិនបន្ទាន់ខ្លាំងឬក៏បន្ទាន់ខ្លាំងនោះទេក្រុមចុះអន្តរាគមន៍ដល់ទីកន្លែងនឹងវាយតម្លៃទៅតាមស្ថានភាពជាក់ស្ដែងនៃសំណូមពរទៅតាមទូរស័ព្ទនោះបាទរួចហើយក្រុមនេះនឹងសម្រេចចាត់ចែងអង្គភាពស្រស់ស្របណាមួយឲ្យចុះទៅដោះស្រាយបញ្ហានោះភ្លាមដែរបាទអង្គភាពនោះអាចជាខាងប៉ូលីសខាងពលរដ្ឋអគ្គិភ័យឬក៏ក្រុមដោះស្រាយវិបត្តិផ្លូវចិត្តឬក៏ CCR នេះតែម្ដងបើសំណូមពររបស់បងប្អូនត្រូវនឹងការឆ្លើយតបទៅរបស់ក្រុមដោះស្រាយវិបត្តិផ្លូវចិត្តឬ CCR នោះក្រុមនេះនឹងត្រូវចុះទៅដល់ទីតាំងផ្ទាល់បើសំណូមពររបស់បងប្អូនមិនត្រូវនឹងក្រុមឆ្លើយតបរបស់ក្រុម CCR នេះក្រុមនេះនឹងមិនចាំបាច់ចុះទៅទេក៏ប៉ុន្តែទោះជាយ៉ាងនេះក្តីបើសំណូមពររបស់បងប្អូនដែលចូលទូរស័ព្ទចូលមកនោះបង្ហាញឲ្យឃើញនៅស្ថានភាពដែលអាចមានគ្រោះថ្នាក់ដល់ជីវិតនិងត្រូវសង្គ្រោះបន្ទាន់ក្រុមអន្តរាគមន៍នឹងបញ្ជូនអង្គភាពសមស្របណាមួយផ្សេងទៀតឲ្យចុះទៅជួយរួមដោះស្រាយដែរដែលក្រុមនេះអាចមកពីខាងប៉ូលីសឬក៏ខាងពលរដ្ឋអគ្គិភ័យបាទយើងខ្ញុំមានសេចក្តីរំភើបដែលឃើញមានការដាក់ឲ្យដំណើរការក្រុមដោះស្រាយវិបត្តិផ្លូវចិត្តឬក៏ CCHR នេះសំទុះ CCR នេះរបស់ក្រុងឡុងបិចរបស់យើងការដែលយើងដាក់ក្រុមឆ្លើយតបទៅនឹងបញ្ហាសុខភាពសាធារណៈនិងសុវត្ថិភាពសាធារណៈនេះគឺធ្វើឲ្យពួកគាត់បានធ្វើការរួមគ្នាដើម្បីដោះស្រាយបញ្ហាលំបាកជាមួយគ្នាបែបនេះគឺយើងកំពុងតែធ្វើយ៉ាងណាធានាឲ្យបានថាសហគមន៍របស់យើងពិតជាទទួលបានធនធានការអប់រំត្រឹមត្រូវនិងការឆ្លើយតបមួយប្រកបដោយការយកចិត្តទុកដាក់និងការយល់ចិត្តរបស់សហគមន៍របស់យើងបាទសូមអរគុណ